Afternoon is Brazoria County's Public Health Director, our Public Health Authority, Dr. Scott Rogers, and Brazoria County's Health Director, Kathy Spruce. And before we begin, before I get into it, I'd like to turn it over to Dr. Rogers for his comments. Dr. Rogers?
Thank you, Judge. Just a few comments this afternoon, sort of regarding where we are. We're now 12 days into the COVID-19 situation in Brazoria County. Our first cases were Friday, March the 13th. We've had more recently a more exponential increase in number of cases in the county, which is typical for this type of epidemic. We're now at 33 cases in the county. I wanted to bring some folks up to date a little bit about the nature of the illnesses in our county. Most folks have handled the illness very well, have sheltered at home. They are being followed and monitored by appropriate personnel. Currently, the very early cases, the ones from the 13th, are almost through their isolation period. I wanted to reinforce a few things that are going to be talked about more in depth as this meeting goes on. There is some science to some of the things that we're doing. The effectiveness of sheltering in place has been proven. There's good medical science to back that. It's not something that we enjoy doing, and it's something that's stressful for all of us. But we hope to slow down the increase of cases. It's going to be with us for a while, and we realize that. But we're doing appropriate things here in Brazoria County to help us deal with it. I also wanted to reassure everyone that currently our hospitals are well prepared in Brazoria County. We have beds that are available, and we'll continue to keep a close watch on that situation. And that was the main issues I wanted to reassure folks on. Remembering for most of us, it's an infection that our bodies can handle and can deal with. We're most concerned, of course, about folks with other health issues. You've seen it all over the internet and TV. People with comorbid issues that get the virus are at a much higher risk. So we are doing our best to be prepared, and some of the things that Judge Sylvester will be talking about are going to help us get through these next couple of months. And with that, I'll turn the podium back over to the Judge.
Thank you, Dr. Rogers. Sharon, are we live on? All right, do we need to? Okay. Do we need to? We need to start over? Okay. All right. Thank you, Dr. Rogers. Now I'd like to ask Kathy Spruce, our Public Health Director, to come up and give us an update as well. Kathy's background as an infectious disease professional has been invaluable during this public health emergency. Kathy?
Thank you, Judge. Good afternoon. I'm here to give you a little update that we have had a recent jump in cases, and as Dr. Rogers pointed out, we are up to 33. We've had 5 new cases today, and we identified 9 yesterday. Most of the cases have been stable and are just providing self-care at home while isolating themselves from the public. 3 of them were hospitalized but were released to home in stable condition. This is a very contagious disease, and contact with just one infected person can spread the disease. I urge you not to become complacent with your behaviors. It is absolutely critical that you follow the recommendations that have been set forth to stop the spread of this disease. For businesses that continue operating, please find ways to eliminate congregating of people on your job sites. For example, meetings rooms, lunch rooms. We do continue to get reports from facilities that say large groups are gathering for these types of activities, and we need you to find alternative methods. You must maintain social distancing. We need you to stay at least 6 feet apart from other people. Anyone who is sick with COVID-19 symptoms should stay home. If someone in your household has tested positive for COVID-19, keep the entire household at home. If you are an elderly person or a person with a serious underlying health condition that can put you at increased risk, we ask that you please stay home and away from other people. Thank you.
Thank you, Kathy. And I appreciate both Dr. Rogers and Kathy joining me this afternoon. Early this afternoon, I issued the Brazoria County Stay Safe at Home order, which will take effect at 6 p.m. tomorrow, Thursday, March the 26th, and go through 11:59 on April the 3rd, 11:59 p.m. Before going into details on that, I'd like to thank Dr. Rogers, Ms. Spruce, the Brazoria County District Attorney's Office, my staff, and especially the rest of Commissioners Court for all of their input in crafting this order to be a best fit for Brazoria County. This action is not being taken lightly. I've received advice from our local medical community, as well as from folks in the Texas Medical Center prior to taking this action. As we see the number of cases rise locally, statewide, and throughout the nation, the advice across the board has been to take action to slow the spread of this disease down, and that is the task before us. The reasons to take this action: 1, let's not overwhelm our healthcare system. 2, we need to allow manufacturing to catch up on the production and manufacturing of personal protective equipment to protect our healthcare providers. Allow doctors to find the best courses of treatment for patients who have COVID-19, and to allow the medical community more time to research and hopefully produce vaccines for this disease. We all of us here in Brazoria County need to work together to stem this rising tide. And by working together as a community, I believe that we can make that happen. The actions being taken today will hopefully lessen the overall impact to our local economy and our community. All efforts being taken are to shorten the duration of this so that it is not a long, prolonged event that will have more lingering and long-term effects on our community. And by working together, we can all do that together. The order I signed defines essential businesses that may remain open during this event. We didn't just pick and choose businesses. We used some guidance from the Department of Homeland Security to identify those essential businesses that may remain open throughout the duration of the order. One of the things I want to stress to our local citizens: you may still go to the grocery store to pick up your groceries. We encourage you to use delivery if you can, or the curbside pickup. You may still go to the pharmacy to pick up your medicines. Highly encourage you. You may still be able to go on your walk through your neighborhood, to go biking, hiking, and jogging. We encourage you to do those things. Just don't do them in groups. Do them solitarily. You may still go to your favorite restaurant for takeout or drive-through. I highly encourage you to support our local businesses while we go through this event. You may still go and see an elderly person from your church or family member to run their errands, to pick up their groceries, their medicines, and check in on them. We just ask you to do it safely per the CDC guidelines with social distancing. The list of businesses, well, and the public reference guide we're going to be issuing for businesses and other organizations Mrs. Spruce touched on. We ask you to make sure that as you continue to operate your essential business, that you do it in a smart way to curb the spread of this disease. I want to touch base on some of the businesses that we've identified as being non-essential during a public health emergency. And these businesses, in normal times, you're absolutely essential to us in this community, but during a public health emergency that has been issued, these are the businesses that will not remain open. Barbershops, nail salons, and hair salons. Spas, massage parlors, tanning salons, estheticians, and related personal care businesses. Commercial amusement and entertainment establishments such as theaters or bowling alleys. Gyms, fitness classes, and yoga and personal training facilities. Tattoo and piercing parlors. Residential meeting spaces and event centers. Hotel meeting spaces and ballrooms. And outdoor plazas and markets. Those are the non-essential businesses that will not be able to remain open. We will be issuing this document as well as several others that will come out on our Facebook page, all of our social media, as well as our Brazoria County website. We will be posting all of these issues out, or these lists out there, so that folks can hopefully understand where we are at this time and what the order contains. So I'm going to ask you, Brazoria County, please come together as we've had over the last 5 years as we have faced flooding and Hurricane Harvey. We've all come together great as a community to lift one another up. And I'm going to ask you at this point in time to come together and let us all work together to help stem the tide of the spread of COVID-19. And with you working with us, we can make that happen so that we can get back to normal as quickly as possible. So please continue to follow us on all of our social media and our website. We'll continue to push out information as quick as we can get it. And we encourage you to please observe this order and do everything you can to help stem the tide on this. So thank you, Brazoria County.